Yes, it is possible to remove whole lung in a certain patient. So again, before the patients go for surgery, we not only look at how the cancer looks and if you can remove it, but also what the lung function tests of the patients are before the surgery. And we also calculate what will be the post-operative lung function if you remove whole lung or any part of the lung. In general, the right lung is slightly bigger than the left lung. So in general, the largest amount of lung removal which we do is basically right pneumonectomy, meaning removal of the right lung. It's possible to remove whole lung on a patients who have preserved lung function before the surgery. So that all depends, as I mentioned, when we calculate post-operative expected lung functions. If we expect that the patient will have enough reserves to undertake it, they will have less lung capacity. So on some occasions, they need to slow down when they are walking, or they might be a little bit short of puff when they are walking against the wind or to the hills or stairs, or if it's very hot or very cold weather. We don't perform pneumonectomy on patients which we would expect that they will not do very well after surgery. What happens inside the chest once the lung is removed? Naturally, the body or the chest produces a bit of fluid every day, which is basically collecting in a space after lung removal. So after 4 to 6 weeks, when the patient is seen in a clinic, usually the fluids completely fill the cavity after lung removal. And that's how it remains in the future as well.
So naturally within the body there'll be an attempt to not leave a vacuum, and the fluid build-up is a way for the body to balance that empty space where the lung used to be?
That's absolutely right. So in the circumstances when we remove only part of the lung, what happens is that the surrounding tissue will decrease the amount of air after lung removal, and also the remaining lung will sort of hyper expand. So the body naturally doesn't like any airspace in the places like chest. So in a scenario we remove only part of the lung, the rest of the lung will sort of take over, and also the diaphragm will move a little bit up, and the mediastinum, meaning the middle part of the chest, will move a little bit to the side of resection.
If someone has signs of some small cancer, but it's actually in both lungs, is it possible to have surgery?
It is definitely possible. Again, it depends on the lung functions of the patient, just to clarify how much lung actually we are able to remove. So it's safe for the patient with reasonable quality of life after operation. On some instances, we need to clarify if the two lesions which the patient have, if they are likely to be the same cancer, meaning patient develop cancer in one lung and that cancer can seed into the other side, or if it is actually two completely independent lung cancers, which is probably more likely. So in these circumstances, when we see that patient have two lung cancers, we usually deal with the larger one earlier first, because we would like to prevent progression of that large cancer and then continue with the smaller cancers such on the other side. So it is possible. It's not completely uncommon. On some occasions, we also see patients who have lung cancer removed, and then we usually continue with CT follow-up for the next 5 years. And on some occasions, we found that within these 5 years, they might develop new lung cancer on the other side. So then they are scheduled for the surgery on the other side as such.